Thank you, Ajit, and welcome everybody. So at the recently concluded United Nations Sustainable Development Summit, the Honourable Prime Minister of India said, "Sustainable development of 1/6 of humanity will be of great consequence to the world and our beautiful planet. It will be a world of fewer challenges and greater hope, and more confident of its success." So indeed, with a population of 1.25 billion, India's health and development will have a great impact on our planet's overall well-being. India was a prominent signatory to the historic Millennium Declaration of September 2000 and has remained committed to the cause. India has made noteworthy progress towards achieving some of the Millennium Development Goals. Notably, it has already achieved the target for reducing poverty by half and achieved gender parity in primary school enrollment. The control of diseases such as HIV, tuberculosis, malaria and polio has been a major success for India. Although maternal and child health targets were not fully achieved, India made significant progress. It reduced the maternal mortality rate from 437 to 140 deaths per 1,000 live births, and under 5 mortality rate from 126 to 40 per 1,000 live births, and infant mortality from 80 to 39 per 1,000 live births between 1990 and 2015. As we now start adopting a new set of transformative and universal sustainable development goals, the SDGs, there will be further impetus to the achievements made by virtue of the Millennium Development Goals. This will be further made possible with the remarkable convergence of vision underlying the priorities of the proposed 17 SDGs and those of the current government of India. I would like to say that it's my singular privilege of sharing this stage with the leaders from this progressive government. And of course, it's an honour to be in the presence of Dr. Debbie Shetty, the Henry Ford of heart surgery and the pioneer of affordable quality healthcare in India, among other achievements. India has been making steady strides in health development since it became a republic in 1951. In fact, the Bohr Committee that was appointed pre-independence provided a comprehensive analysis of the state of healthcare in India and a vision of universal health coverage, which even today remains a lofty objective. The Alma Ata Declaration of 1978, to which India was a signatory, reinvigorated our commitment to primary healthcare and influenced India's first official national health policy of 1983 that emphasized the need for universal, comprehensive care. India's come a long way since then, and the draft National Health Policy 2015 has been placed in the public domain for feedback. The preamble of the policy states that the primary aim of the National Health Policy 2015 is to inform, clarify, strengthen, and prioritize the role of government in shaping health systems in all its dimensions, namely investment in health, organization and financing of healthcare services, prevention of disease and promotion of good health through cross-sectoral action, access to technologies, developing human resources, encouraging medical pluralism, building the knowledge base required for better health, and financial protection strategies and regulation and legislation for health. Among these priorities, or priority areas, building the knowledge base for better healthcare and access to technologies resonate deeply with Elsevier, and our mission to lead the way in advancing science, technology, and health. Our customers are doing momentous things, and we are uniquely positioned to show our customers the art of the possible. For more than 130 years, Elsevier has shared their commitment to transforming and advancing science, health, and technology. We understand the worlds in which clinicians, educators, and academic and corporate researchers work, the outcomes they want to achieve, and the challenges they face in achieving them. We have a responsibility to use that understanding to create highly effective solutions that enable our customers to leverage the vast potential of information to advance science, health, and technology in ways that they could not do alone, and to anticipate the new ways customers will want us to use information in the future. That is what we mean by leading the way. With the launch of the book, Healthcare Reforms in India, Making Up for the Lost Decades, we are leading the way again by providing a platform for some progressive thoughts penned by a very accomplished man of science, Mr. Rajendra Gupta. India's healthcare industry, by some estimates, is forecast to grow at a compound annual rate of 15% and is set to reach $280 billion by 2020. It is one of the largest sectors in terms of revenue as well as employment. It offers direct employment to approximately 5 million citizens. Yet despite the significant number in health employment, the doctor-to-patient ratio remains well below the World Health Organization's stipulated minimum doctor-to-patient ratio of 1 to 1,000. The number of qualified practicing doctors in India, according to a Lancet study, may be closer to 0.4 per thousand population, rather than official estimates which fall in the range of 0.6 to 0.7 per thousand. And the total number of qualified health workers may be closer to 1 per thousand population rather than the 2 per thousand population reported in the census. This broad measure counts nurses, midwives, Ayurvedic health workers, dentists, and pharmacists alongside doctors. And compounding the issue, there are only 0.12 doctors in rural areas compared to 1.13 doctors per thousand population in urban areas, reflecting the fact that rural areas present both a larger population and a higher proportion of health professionals reporting insufficient qualifications. So, how should these incongruities be resolved? In our view, health education reform and technology are a major determinant of health outcomes. The Pradhan Mantri Swasthya Suraksha Yojana is a step in the right direction, with its aim of correcting the imbalances in the availability of affordable healthcare facilities in the different parts of the country, and augmenting facilities for quality medical education in the underserved states in particular. We can look forward to a better doctor population coverage, particularly in the rural areas. The decision to set up 8 AIMS-like institutions and upgrading many existing medical colleges has the potential to make a significant impact on the quantity as well as the quality of medical professionals. Another big challenge we face is to overcome the deflexionization process, which is currently underway, in which low-quality professional institutions are proliferating again. According to one of our Lancet commissions, what is required is a series of instructional and institutional reforms which should be guided by 2 proposed outcomes: transformative learning and interdependence in health education. This requires developing core competencies beyond the command of knowledge and facts, and including in the curriculum such elements as patient-centered care, interdisciplinary teams, evidence-based practice, continuing quality improvement, and new informatics, research skills, and integration of public health. Implementation of the Medical Council of India Vision 2015, especially electives, integration of family medicine, and adoption of contemporary education technologies, skills lab, e-learning, and simulation, could help in adopting some of these recommendations. Furthermore, standardization and accreditation in medical education inclusion of digital education along with necessary infrastructure, continuing education and professional development in medical licensure requirements, and patient education to eliminate the provider-patient information asymmetry are some of the critical areas that urgently require mandates from the government. With a growing focus on the government's Digital India initiative and the creation of massive digital infrastructure, widespread outreach support to rural health workers, especially the new types of community health workers like the multi-purpose primary healthcare worker, accredited social health activists, has now become possible. Clinical decision support systems technology for physician as well as non-physician healthcare workers has proven to be effective and should be adopted at public as well as private healthcare institutions. With a growing investment in health information technology, especially mobile health, the possibilities have increased manifold. Telemedicine is bridging the rural-urban health divide in probably the cheapest as well as the fastest way. The government recently launched the Social Endeavour for Health and Telemedicine, SEHAT, that aims to connect the largest population of the country on a network of 60,000 common service centres to avail telehealth services. It is imperative that such initiatives be sustained and improved as technology advances. Elsevier's decision to publish a book on a subject matter such as healthcare reforms is uncommon, but is made in exceptional cases that help address the macro aspects of health, and help further our mission in India when the right opportunities come along, and Mr. Gupta's book was one such opportunity. I would like to conclude with the Honourable Prime Minister's concluding statement for the 2030 Agenda for Sustainable Development. There is no cause greater than shaping a world in which every life that enters it can look to a future of security, opportunity and dignity, and no cause that is more challenging. At 70, we are called to rise to that challenge with our wisdom, experience, generosity, compassion, skills and technology. I am confident we can. Thank you.